begin your long case assessment, it's essential to start by establishing a strong rapport with your patient. As you enter the room, perform hand hygiene in view of the patient using the provided alcohol hand rub. Introduce yourself with a friendly tone, maintain steady eye contact, and if appropriate, offer a handshake. Thank the patient for their willingness to participate and emphasize that this examination is an important step in your specialist training, kindly requesting their cooperation throughout the process. If you anticipate any interruptions due to time constraints, it is courteous to apologize in advance. Next, begin the encounter with an open-ended question such as, "Can you tell me about your main medical problem?" Allow the patient to share their story as fully as possible while you listen attentively. Many patients are quite knowledgeable about their conditions, having participated in previous exams, so their narrative provides invaluable insight into their perspective and priorities. As the patient speaks, use your clinical discretion to ask clarifying questions to capture key details without rushing, ensuring that you cover all the aspects needed for your documentation. While the patient's narrative is critical, it is equally important to use your clinical judgment to probe deeper. After the initial story, ask if there is anything they might have forgotten to mention or any additional details they feel are important, encouraging them to elaborate with questions like, "Is there anything else you'd like to add?" or "Have you noticed any other symptoms that might be related?" Helps fill in any gaps in the history. As you transition to the physical examination, continue to engage with the patient by explaining each step clearly. Provide concise instructions about what you are about to do so that the patient remains comfortable and understands the process. It is important to maintain a patient-centered approach by avoiding any maneuvers that may cause discomfort or pain. If you need to interrupt the exam due to time pressures, do so politely, briefly explaining the reason for the interruption. Throughout the 60 minutes allotted for the long case, be mindful of the time. Aim to complete your history taking and physical examination within 50 to 55 minutes, leaving a dedicated period for reflection and for seeking additional clarifications from the patient if needed. Before time runs out, use these final minutes to gather your thoughts, synthesize the information you've collected, and ensure that no important detail is omitted from your final presentation. As you conclude the patient encounter, confirm with the patient whether there is anything else they would like to add. Provide a brief summary of the patient's narrative and your initial clinical impressions. This summary not only reinforces your understanding of their condition, but also sets the stage for your subsequent case write-up. In essence, a patient-centered approach in a long case assessment involves establishing strong rapport, eliciting a detailed narrative, using clinical judgment to probe for additional details, and maintaining clear communication throughout the physical examination. By managing your time effectively, aiming to complete the exam within 50 to 55 minutes, you allow yourself an opportunity to reflect and clarify, ensuring a comprehensive and integrated assessment. This systematic approach not only prepares you for the exam, but also lays the foundation for excellent clinical practice.